Hands are the main transmitters of pathogens in the hospital. I think disinfection, especially hand disinfection, plays a decisive role in the hospital. I think that now and then it tends to get forgotten. As can be seen, the number of nosocomial infections does not decrease. If anything, it increases. In practice, every other hand disinfection necessary to protect the patient is not carried out. It might be that nursing staff and physicians are afraid that their skin dries. For 30 years I've been in the profession now. I've always disinfected my hands and up to now have never suffered any damage. Healthcare-associated infections are one of the top 10 leading causes of death in the United States of America. Approximately 4.1 million patients are estimated to acquire a healthcare-associated infection in the EU every year. Primary sepsis, urinary tract infection, ventilator-associated pneumonia, wound infection, and infections caused by multi-resistant microorganisms are most frequent. Studies show that employees' hands play a key role. In the daily hospital routine, they are permanently colonized by microorganisms. And their number increases the longer the activity lasts, an average of 16 germs adding per minute. Disinfection could prevent the transmission of germs, but only if hands are disinfected when it is of advantage to the patient, as suggested in recommendations. The technical term for this is compliance. However, practice shows that on average, every other hand disinfection, which would be necessary to protect the patient, is not carried out. Incomplete and too short disinfections come on top. The reasons for this poor compliance are manifold. Poor skin tolerability is one of the reasons frequently offered when it comes to hand disinfection. However, the leading cause of skin damage is washing hands too often and too extensively. The skin is damaged and burns as soon as it comes into contact with the disinfectant's alcohol. To treat the skin with care, employees should only wash their hands before shift. This suffices to remove possibly existing soils and potential spores from the hands. It's also reasonable to wash the hands in case they are visibly soiled. Furthermore, the regular application of skincare products helps keep the skin healthy. In addition to healthy skin, availability and easy accessibility of hand disinfectants are an important precondition for the compliance with hand disinfection. Products should be available where direct or indirect contacts between patient and caregiver might occur. Outside and inside each patient room, in wet rooms, and in nurses' stations. First of all, one should know the situations in which hand disinfection is really valuable. Yes, we have certain rules. Before we enter a patient room, we always disinfect our hands. Well, before and after each patient contact, and after having been exposed to infectious material. In my opinion, one should actually disinfect the hands as often as possible. Before going to the patient and when leaving the patient. There are also tasks that require a prior hand disinfection, for example, the preparation of intravenous fluids. This has to become second nature. When I leave the patient, I disinfect my hands. Within the scope of a worldwide campaign, the 5 moments requiring hand disinfection were defined. These 5 moments are typical situations in patient care that are linked to an increased risk of transmission. In principle, employees should always carry out hand disinfection before they touch a patient, for example, prior to changing a dressing. Aseptic tasks such as manipulating catheters or preparing injections also require a prior disinfection of the hands. These before indications serve patient protection and should prevent the transmission of pathogens to patients. Moreover, there's the risk that pathogens are transmitted to employees and then spread to the surroundings and additional patients. To prevent this, hand disinfection is also to be performed after certain caregiving tasks, even when gloves are worn. Another important moment is the contact with body fluids, for example, after an endotracheal aspiration. A risk of transmission also emanates from the immediate surroundings of the patient. Even in a case where the patient is not touched directly, the hands have to be disinfected when leaving the patient room. When asked, the majority of employees would not be able to perform this specific set of 6 steps right away. I wet my hands so that every part of my hand is covered with the disinfectant. Yes, one tries to make sure to completely wet the hands with the solution. We disinfect for 30 seconds, so until the hands are dry, sometimes even longer. It's been shown that a proper coverage takes 25 to 30 seconds. For a start, the actual effectiveness of hand disinfection depends on the personal hygiene of each employee. Jewelry on hands and forearms promotes the transmission of pathogens. Germs colonize the surface, and the disinfectant cannot reach all parts. Watches and rings, also wedding rings, are therefore removed before shift. Short and round fingernails do not provide pathogens with niches in which to hide. This is also the reason why healthcare workers should not wear painted or artificial nails during work. Both are risk factors for a contamination. There are also recommendations on the application of the hand disinfectant. For a long time, the 6 steps of the European norm EN 1500 were considered standard for hygienic hand disinfection. Latest findings, however, show that the so-called self-dependent rub-in method yields the best results in coverage. For this, employees use their own rub-in technique and pay attention to a complete coverage. For an effective hand disinfection in accordance with the self-dependent rub-in method, apply a sufficient amount of hand disinfectant to the cupped hand. Thoroughly wet all areas of the hand with the preparation. Pay particular attention to fingertips and thumbs. Both are particularly important as they most frequently come into direct contact with patients and potentially contaminated surfaces. Furthermore, fingertips harbor the highest concentration of bacteria. The hand disinfectant should be rubbed into the hands carefully for 30 seconds. But even the self-dependent rub-in method is no guarantee for 100% coverage. To make sure that no gaps occur, employees need to be trained intensively. In training sessions, they can identify their individual weak points and correct these. Fluorescent test solutions have proved their worth in such training sessions. They are added to the alcohol-based hand disinfectant. All participants carry out the hygienic hand disinfection with the test solution for the recommended exposure time of 30 seconds. Afterwards, treated hands are held in a box with black light. The effect: covered skin areas appear white, untreated or insufficiently covered parts remain dark. This descriptive fluorescence method results in particularly long-lasting successes in learning. Well, hands are simply the highest risk of infection, as they touch everything. It's key that the disinfectant is available where it's needed. Nowadays, there are many possibilities in the clinic to find the product one likes and to use it. Another possibility to increase the success of hand disinfection are pocket bottles. The advantage, they are always within reach when required. I think it's good because you always carry the disinfectant with you. Perhaps many employees are not aware of the great effect this simple measure can achieve. In many hospitals around the world, pocket bottles have increased compliance and have reduced the rate of nosocomial infection. Critics note that pocket bottles are not hygienic and even promote the spread of germs. This is not the case when they are used properly. To do so, take the bottle out of the pocket with one hand. The flip-top lid can easily be opened with the thumb. Now apply enough hand disinfectant to the cupped hand. Close the lid with the free hand and put the bottle back into the pocket. Now thoroughly wet and carefully disinfect both hands with the disinfectant until they are dry. In doing so, pay particular attention to fingertips and thumbs. It's imperative to observe the exposure time of 30 seconds. In general, this is the case when enough hand disinfectant is applied, as the product needs a certain time to dry entirely. Hand disinfectants with good skin tolerability, regular training, and adequate availability of products already take essential hurdles of compliance with hand disinfection. The role model of senior employees, no matter of which occupational group, also has a positive effect on compliance. Around 30% of all infections contracted in hospitals could be prevented by hand disinfection. A worthwhile goal.